We're actually talking just today about this question with Dr. Xiao by email because some new developments have come out. So the question came from the audience: is there any new evidence of COVID affecting pregnancy in people with Crohn's or the general population? So when Dr. Xiao and Dr. Pham Hui presented on this topic, on sort of mothers and newborns with IBD and COVID and what was happening, that was, I think, week 2. There really wasn't much evidence, but there were some reports from China that COVID did not seem to affect pregnant women any more severely than other women of the same age, and that it didn't seem to get transmitted through pregnancy. Certainly, we knew that if a mother was actively infected and coughing, and that could infect the baby, but we didn't think it was being transmitted through pregnancy. Gil, do you want to talk about some of the new studies that just came out?
Yeah, well, so there's just been recent case reports where there has been evidence of what we call vertical transmission. So if you're pregnant and you have active COVID and you deliver a baby, there's been case reports where the COVID was actually discovered in the newborn as well. And again, when we say case reports, that means that in the world of experience, all of the physicians around the world are trying to look for unique patterns. And anytime something unique happens, we report that and we start to learn from it. But it means that there's only been a handful of cases out of whole world, which means the vast majority of pregnancies have been in women who have not had COVID, and we haven't seen any issues. There have been women who have had COVID, had pregnancy, and have not had vertical transmission. And now we're identifying that there is the potential that can happen. And what that means is, obviously we have less control in terms of timing of pregnancies, deliveries, and in that. But it means that the healthcare system has to be prepared for that knowledge and has to be set up in such a way to protect everyone in that pregnancy unit, from the healthcare providers, the physician, the nurse who's doing the delivery, to the mother, to the partner who is beside the mother, to the fetus that is born. And Eric, maybe as a pediatrician, I'm wondering if you can give a sense of what would happen in that kind of scenario if somebody, and again, these are very rare scenarios, but if somebody did have COVID and the baby was born in that scenario, what would happen from a healthcare perspective in the neonatal unit?
Yeah, so the first thing to just make note of is even in these cases of vertical transmission, the babies did fine. There was no, birth defects, and there's been no reports of any birth defects when mother gets it while she's pregnant. And in the 2 cases that I'm aware of, one from China and one from Toronto, actually, in both cases, the baby was asymptomatic. So the only reason they knew that the baby had COVID infected in the womb was because they did antibodies on the baby, and those antibodies wouldn't show up until 3 to 7 days after the baby was infected, which is when the baby was still in the womb. We know some of the problems with those antibody tests. You probably heard on the news, they're not perfect tests. So we don't know for sure this is the case. But the good news is that the babies were asymptomatic and did fine. The Canadian Pediatric Society is recommending that the baby continue to breastfeed, and we just enact protective measures, meaning masks, gowns, gloves. The mother would be in an isolation room, and so the baby would be protected from actively being coughed on, but we would still continue to breastfeed, and we would still continue to do as much as we could to have a normal newborn experience and normal newborn growth and bonding with the mother. So for right now anyway, I don't think too much has changed compared to when we talked about this at week 2, that we can still allow the baby to do all the normal baby things and just basically watch carefully, I think, is the bottom line. So these 2 case reports really recommended that if the mother is infected with COVID-19, with the SARS-CoV-2 virus, that we just watch the baby. We do special testing at birth of blood, umbilical cord, blood, and placenta to see whether there was virus in those samples, and then watch the baby carefully.